want to describe you, Margaret, your symptoms as to give us as more details, as many details as you can, please.
Okay, absolutely. It started in 2019 with an excruciating pain that woke me up in the middle of the night. Started in the jaw, and it almost felt like it was a tooth, but then it spread, so I could never really figure out what tooth it was. It ended up being this whole lower jaw, and then it extended to my upper jaw, and then it extended up to the temple area. And the when I first got it, I was getting the attacks every half hour, and they lasted for like 2 minutes. And it felt like, I explained it to my doctor, it felt like somebody took a screwdriver and put it in my jaw, attached it to a car battery, and revved it for 2 minutes. That's what it felt like. It was excruciating. So then I went to a dentist who ended up doing a couple root canals, or one root canal and then some other work here, and he said this may help. And I think that maybe at the time he may have done some adjusting, because I then was in remission until like 4 weeks ago, and then it came with stress, and I knew I was clenching my jaw, and it woke me up in the middle of the night again, which I hear is very unusual for trigeminal neuralgia, and it was an episode that it didn't stop. It was every 5 minutes all night long for at least 8 or 9 hours, and then that's when I started researching. The brain surgery I was not going to consider because it's not effective, and being the naturalist that I am, I didn't want to do medication, so I was just trying to get through the pain with natural remedies instead of going the conventional route. And then my mother found the YouTube video, the dentist in Oregon. And then I found a list, and I remember going through the list, and I please, Florida. And you were the second to last. I'm like, oh, thank God, Boca. So here I am, and yeah, hoping that this works, but I have faith.
Yes, perfect. So let's start the procedure.
Okay, let's go.
How about now? Do you still feel pressure on that side? Not anymore?
Not as much. So if I bite wrong, like, I'm still trying to find my bite, so I
You
don't know
will
what
be.
my real bite is.
Mm-hmm.
That's the thing. I've been trying to shift my jaw around to try to bite, and so I don't even know what my real bite is.
Your muscles are being distracted, and they need to find a new position based on the head posture, based on the
Yeah.
shoulders, based on your total body posture. So they will be seeking that final position for some time, for at least 4 weeks.
Good. Now I can start yoga again. I had stopped all exercise, everything, because I was so
Very subtle,
living.
super subtle, yeah.
Yeah. So now I can start everything.
Okay, let's do, no, we're doing the left movement. So you bite down, you try to squeeze, and then go to the left. Bite down, squeeze, and go to the left. Left. Okay, that is good. Let's do one second. So masseters are complete. Right down, hold it, squeeze it, and go to the right.
Wow, that's different.
Yeah, and the timing is, you do it much faster. So if
Yeah, I'm
you
not
look-
afraid as much. I can bite harder.
You can bite harder, and I don't see any, like, even smaller forces, so everything is even. And this AB, which is the timing on how fast you bite, even if we do it at the very beginning,
Yeah.
so that was, let me do the right side. AB was longer, so that was
Yeah.
longer. That is even longer here. And the final thing is, it's close, so if I put this timing here, put it on, So 0.55, I still want to be under 0.2. I
Okay.
still want to be under, but with all these forces, I don't know which to touch. So I wouldn't do anything right now. I would wait.
Okay.
So clench, keep it.
Uh-huh.
Right down, clench, and left. Okay, open. We have both. We don't have any masseter activity here. I don't see
Yeah,
nothing.
I don't
Nothing.
feel anything. Yeah, you did an incredible job just on the first.
Yeah, we have a little bit on the right temporal, which is fine. Most of the activity is left temporal, which is obvious, which is what we want. What we want. And almost nothing,
I
like
know.
barely.
Yeah,
barely
bravo
something.
to you.
Mhm.
Bravo.
And let's do
Yeah.
the right side, same thing.
Mm-hmm.
Open her knee. Right down, and keep it together, and then the right side. Open. Okay. Yeah, it's
It's just a weird movement.
immediate disocclusion, like they separate immediately. There's nothing that holds them together.
Right.
Both masters are like almost nothing. 12.
And I felt like before I was stopped, like I couldn't keep moving because I was being stopped by my teeth.
There was something in the middle. Yeah.
Mm-hmm.
Let me check everything.
Okay,
Let me
sure.
Just clean it up. Okay, so
Oh, sure.
Yeah, so we have Margaret here coming after how many? 2 months?
Yes, since November 13th.
Yeah. So what changed since then?
Absolutely everything. I was taking medication on a pretty regular basis for pain. It was keeping me up all night. It was so excruciating. So after the first visit, I felt a couple changes. First of all, I felt a lot of vibration and almost like circulation. I could almost feel that changing. And it took me a while, but now I'm eating with my right side. And now it's like I never had it. The pain is completely gone. I don't even remember what it felt like. Yeah, so it took me a little while to get used to biting on that side. I was still very sensitive. The tooth that was loose is no longer loose.
Okay.
And I have full use of my right side of my mouth. It's just completely disappeared.
Is there anything else that you feel need to be addressed? Like still some like little points, maybe
It's
some.
hard for me to tell. It's probably very minute, something that maybe the machine can pick up, something that I'm not that sensitive. It's so funny, today I was like trying to rub my teeth back and forth, and I think I'm still psychologically afraid.
Yeah.
But not so much that it's, I mean, it was so extreme before that in comparison, it's like nothing. There may be, but not that I can pick it up because there's no more pain.
Perfect.
Mhm.
Okay.
Thank you.